the evils of social media and the stand-up comic who wants to be governor of New Jersey. No joke. The Point starts right now. Dr. Ashwin Vasan is New York City's health commissioner, and one of the reasons I was excited to be able to talk to you was about the crisis that we're having with social media. I'm wondering, why did the mayor, obviously with your assent, declare social media as a health hazard?
Well, it's good to be here with you, Marcia. We're in the midst of a youth mental health crisis. We're seeing unprecedented rates of anxiety, depression, loneliness, hopelessness,
suicide,
and even suicidal thoughts and suicides in younger and younger kids, especially our teens. So we're in agreement that we're in a crisis. The U.S. Surgeon General, the American Academy of Pediatrics, the American Academy of Family Physicians have all said that social media is contributing to this. And so from a city's perspective, we said, all right, what are the tools we have at our disposal to try to make a difference? We know that this is a problem that's much bigger than New York City, and no one is saying get rid of social media. It's a part of our lives, but we got to use those tools.
So you're suing the social media companies. What do you want them to do?
We want them to start to put some rules of the road in place into how they design these platforms. Boosted algorithms, targeted ads to kids, content moderation. I mean, these are just some of the steps.
Get rid of the targeted ads.
Targeted ads to kids. To kids under 18, they're getting over $1 billion in revenue coming from targeted ads just to our children because of things they click on. That's not responsible.
But isn't there a financial benefit to the companies to have the ads, and how do you convince them that to forgo the cash for because it would be much more beneficial for younger people?
I mean, this is all about financial benefit to the companies, so we can't ask. This isn't about asking for permission. This is about using the tools of the law. It's about using policy and legislation. That's what government does. Step in and say, no, you need to do this. When we needed seatbelts, when we started to have a rash of automobile accidents as cars got better and faster, we said the government needs to step in and mandate seatbelts. This is our seatbelts. We're asking for seatbelts on social media.
Is this a federal government thing, or can New York State or New York City do it alone?
Well, we have the Kids Online Safety Act. It has over 60 sponsors in the Senate. We need to get a House sponsor. We need it to be passed and signed by the president. That's a floor. But you've seen what Senator Gennardis has done at the state level and others. We need multiple layers of regulation and control over this uncontrolled system.
So what role do the parents have to play in this? I've seen some recommendations, for example, that they shouldn't give a smartphone to a child until they're 14. It seems an awfully high level of an older age when so many kids have smartphones when they're like 5, 6, 7.
And we think that's really dangerous because we know that the brain development, in particular between the ages of 8 and 14, those are the ages when kids are forming their identity, forming social relationships, figuring out how to take risks safely and not so safely. Exposing them to content during that really vulnerable time is really dangerous.
So you're saying 14 is the right age to give kids a smartphone for the first time?
14 is the best age, after which you reassess the data, but also reassess your kid. How are they in their social and emotional development?
So what's the danger if you give a kid a cell phone at, say, 10 or 8?
Well, like I said, these are really vulnerable times of brain development, right? Your kids' brains are vulnerable. That's why we're doing this. This is having an impact on the brain, and research has shown that this is affecting things like dopamine. This is affecting other neurotransmitters in your brain. So this is a biological phenomenon that these technologies are shaping. So we're saying for at least that age, reassess it at 14 and see if things have gotten safer, things have gotten better, and reassess your child. Because we know in New York City at 14, kids are starting to ride the subway, go into high school alone. We know that parents want to stay in contact. I'm a parent. I got 3 kids. One's going to be 14 in a few years.
Do any of them have cell phones?
They do not, and they will not.
How do they feel about that?
Not well. My 10-year-old wants one yesterday, and she's already angling for YouTube and all this. So this is a fight happening in my own home. But, you know, I'm saying to her, I'm trying to keep you safe. We're trying to do this together.
I bet you she doesn't understand that.
She definitely doesn't, but I'm working hard to make her understand.
I figure if anybody can do it, it's you. You know, this is Daylight Savings Weekend. This airs on Sunday. I wonder if there are thoughts about whether there are adverse effects, health effects from daylight savings.
Oh, that's a good question. Well, I think about it as it relates to sleep and circadian rhythms. Anything that messes up your sleep and your circadian rhythms, whether it's long travel, jet lag, that takes extra care to make up for. So getting your 8 hours as an adult is really essential for healing, for inflammation, for brain recovery, for body recovery.
Should we eliminate daylight savings time for health reasons?
I'm not going to take that position right now.
I know it's a trick question. So another thing that's going on in the city right now is that City Councilwoman Julie Menin is asking the health department to get involved in setting rules for Ozempic, which is, as you and I both know, is used to treat diabetes, but also is being taken by a lot of people for weight loss.
Yeah. Look, these are new drugs. They're having a huge impact on diabetes, and we think there may be great potential for a certain subset of people who deal with chronic weight issues and obesity. We still have a lot to learn. They're still very new drugs. I'm for anything that increases awareness and education, and so we'll look at the language of the bill and see if we can fulfill those obligations, but I'm for anything that can educate the public, because what we are seeing is a little bit of a Wild West where everyone wants to take a GLP-1 like Ozempic or Wegovy or the others, and we need to start to bring some shape and some rules, and we're seeing it directly marketed to people. We're saying, call up this number, you can get it delivered to your house. We need to start to bring some semblance of order here, because it's also constraining the supply.
Well,
diabetics.
Is it creating a shortage?
Absolutely.
So that people
National
who are
shortage.
really actual diabetics, you know, I know somebody who is an actual diabetic who couldn't get the drug last week because they ran out and wanted to give them half the dose that they're supposed to take.
That's right. It's constraining national supply. It's also inflating prices. Americans are paying at least 5 to 10 times more for GLP-1s than in Europe and in other countries. So, you know, there's a lot of complicated pieces to this.
So I also read that, you know, diabetes is like the 6th leading cause of death, and so there's a concern that people who need the drug should be able to get the drug.
Yeah, it's why we spelled out a diabetes goal in Healthy NYC, our population health agenda that we launched at the end of last year. We want to reduce diabetes deaths by 5% by 2030. How are we going to get there? It's not going to be only Ozempic, but it might be a key part of it. But it's got to be also food systems changes. The stuff that we've done on lifestyle medicine has been important. It's got to be about looking at our food system and sugar-sweetened beverages and tobacco control. Like, we need to re-up our efforts there. So there's a lot of opportunity.
So let's talk about COVID. Is it still necessary for people to get COVID vaccine, COVID booster shots? And if so, how often do you recommend?
Well, for the general population, for most of us, we can get one COVID shot a year like we get one flu shot a year. It's especially important that people in high-risk groups get that shot. People over 65, people with underlying health conditions, and people who live with people with those conditions are also at high risk of passing things on, number one. Number two, if you are over 65, the CDC is recommending an additional shot each year.
Is there any danger to that?
There shouldn't be, right? Now we're 4 years into this. We know that these vaccines are safe and effective. We know that they prevent severe disease from COVID and death. So there's no reason why people over 65 should fear taking an extra dose.
But there's a lot of people who do fear it because it's a vaccine. What do you say to them?
Well, we try to reassure them with the data that says this is safe and effective. I mean, now we're at hundreds of millions of doses given out around this country over the last 4 years. And when we look at the events, when we look at the adverse event rate, it's nowhere near what we would see for even drugs that we take all the time. Diabetes drugs, hypertension drugs, blood pressure drugs, cholesterol drugs have higher adverse event rates than these vaccines. And I know it's new. I know it came on during a pandemic, and I know there's a lot of misinformation and fear. But what I can do as a doctor and the city's doctors reassure people these are safe and effective vaccines.
Dr. Vassen, thank you for being here. It's time for a break, and we'll be right back.